Controversy7 poses the question, should people have the choice to end their lives? So before we get into some of the details of this controversy, let's start with a few facts. More than 2/3 of all deaths in the United States occur among people over the age of 65. In large part, it's medical advances that have forced us to make decisions that a few decades ago we never thought we would have had to make regarding life and death. So one of the big topics in this controversy is that of euthanasia. The word euthanasia actually comes from ancient Greek and means good death. However, as you probably know, euthanasia connotes something that, for a lot of people, brings up a lot of moral and ethical questions. Let's go through a few definitions before we dive into some of the controversial parts of this life and death. Firstly is active euthanasia. Active euthanasia denotes some deliberate intervention to end the patient's life, such as giving a fatal dose of a pain-killing medication. So someone is actively doing something to purposely hasten the death of another person. This is different than passive euthanasia, which means not doing something. So again, the purpose is to hasten death or to not stop death from happening, but it's more of a withdrawing of some kind of therapy such as life support, or maybe even just not deciding not to start some therapy that not having it will hasten a person's death, like a feeding tube, life support, that kind of thing. Assisted suicide is when a doctor or a family member actively provides the means or carries out the instructions required for an individual to end his or her life. So keeping some of these things in mind, let's talk about some other issues that are more or less related to this issue of hastening death. And we'll come back to euthanasia and some of the other things that surround that topic in a moment. Some of the several common predictors of suicide include intolerable psychological pain and frustration, a feeling of hopelessness or helplessness, communicating the intent to kill oneself. And for many people who have killed themselves through suicide, there has been evidence of clinical depression, which clinical depression is something very different than just the feeling of being down that might be a response to a setback or some sort of a trauma, the kind of thing that might be temporary. Clinical depression is not that. It is not some temporary reaction to some situation. Clinical depression can be very difficult to diagnose, especially in older adults, because it can manifest with a variety of symptoms, some of which might be insomnia, fatigue, the inability to concentrate, anxiety, other physical discomforts, other emotional complaints. So like I said, and especially in older adults, clinical depression can be a very difficult thing to diagnose. So because of this difficulty in diagnosing clinical depression, it can be difficult to determine whether an older adult's rejection of life-saving treatment is an informed choice or is it a sign of depression. So we talked about how, again, passive euthanasia is the withdrawal or maybe the rejection of some sort of treatment, and we know that without that treatment, death will be imminent. So again, difficult to determine if a person does say, hey, you know what, no more. I don't want the feeding tubes. I don't want the life support. Is that truly an informed decision, or could that be coming from a place of depression? So if you look at it from a doctor's perspective, and I'll say doctors, but I also mean nurse practitioners, physician assistants, nurses, other medical personnel, doctors are committed to keeping patients alive at all costs. It's part of the oath that they take when they become doctors. So this alive at all costs attitude may or may not respect someone's decision to end his or her life or to discontinue with treatment that might save one's life. So this whole right to die movement really became more part of public discussion in the late 1960s. And it seems like in the 2000s, I guess you would call it, has really risen up again as becoming a topic of widespread public discussion. But back in the 60s, late 60s and the 70s, there were cases like that of Karen Ann Quinlan, and that happened in 1976, where Karen Ann Quinlan was in a vegetative state, was deemed by doctors that she would never come out of the vegetative state, and Karen Ann Quinlan's family really argued for her to be allowed to die. She was on life support measures to keep her alive. And the whole controversy surrounding this right to die case was that she didn't have anything, like most people of her age, didn't have anything in writing saying what her wishes would have been had she been in the case, which she found herself at this time, unable to communicate her wishes. So because of cases like Karen Ann Quinlan's, the right to die law passed in California in 1976 as the California Natural Death Act. So continuing on this right to die law, under common law in the United States, people do have the basic right to accept or reject medical treatment and also the right to refuse treatment. The sticky part of this is that how does a person or how does the medical team know if that person, if they're not able to communicate, has decided to accept or reject any sort of medical treatment? So if a person is not able to communicate for him or herself, they can have what's called a guardian ad litem. And this is a designated spokesperson who represents the interests of an incapacitated person and will go to court to speak up on behalf of that person that cannot speak up for him or herself. And courts actually rely on two kinds of standards to determine when to withhold treatment, when to withdraw treatment. One of these kinds of standards is called the standard of substituted judgment. And this asks, what would this patient have wanted under these circumstances if he or she were able to express that? The other kind of standard is called the best interest standard. And this one asks, what's the balance of benefits and burdens that a reasonable person might want under these circumstances? So the courts will use both of those to help make decisions about should it be allowed that the treatment is withdrawn or discontinued. Now, all of this becomes a little more clear-cut when a person has an advance directive in place. And an advance directive, which is also called a living will, which includes a power of attorney for health care, it's a legal document. And it allows a person to give as much detail as he or she wants as to what would I want if I became incapacitated, unable to communicate. Would I want life support? Would I not? Would I want feeding tubes, which is another kind of life support? Would I not? It also allows the person to make decisions about all sorts of things regarding their end of life. Things like, I want music playing, I don't. I want this person to be able to speak up for me if I'm not able to speak up for myself. So advance directives are an important document. The tricky part here is that, the goal is to help a person die well. But Americans really lack a clear consensus about exactly what dying well includes. So at a minimum, I think that we can all agree that dying well typically refers to having the right to know one's medical condition and the choice to accept or reject life-prolonging treatment. Of course, it goes way beyond that, but again, partly because we're not having these discussions as much as we should, we really don't have a general consensus about what dying well means. Although people can make decisions ahead of time about what they would want, in most states in the United States, assisting a person to hasten their own death is a crime. And we're seeing in recent years that more and more states are passing laws. Oregon was one amongst the first. Washington, Vermont, California just very recently are passing laws to allow people to get the means by which they can hasten their own death. It is still a crime for a person to assist another person physically with taking that pill or giving that injection. So looking a little bit toward the future, as a loud motorcycle goes by, the Netherlands is actually the country that's gone the farthest in legalizing physician-assisted suicide. I mentioned that in the United States, we're seeing that more and more states are passing laws for some form or another, are allowing people more rights in making decisions around their own death. And one of the things that should be mentioned is this role of palliative care. Palliative care is a philosophy of care which is all about keeping a person comfortable. We hear a lot about palliative care when we talk about end-of-life issues, but palliative care can actually occur at any point in a person's life. A person doesn't have to be on death's doorstep to receive palliative care. Palliative care is a very holistic way of looking at a person, biopsychosocially. It's about bringing in lots of support from lots of different areas. And again, it's about keeping that person comfortable and out of pain. It does tend to happen toward end of life, not exclusively, but it often is paired with hospice, which is a way of providing care to someone who is toward the very end of their life. For a person to be covered by Medicare to get into hospice, they have to be within 6 months of death, according to the best judgment of the doctors. So a lot of people who are very uncomfortable with physician-assisted suicide or any means of hastening death will say that perhaps for some of these people who are requesting physician-assisted suicide, perhaps they're not receiving the type of palliative care or hospice that could make the end of their life naturally more comfortable. The Patient Self-Determination Act is a 1991 law that requires hospitals, nursing homes, and other healthcare facilities to advise all patients at the point of admission that they have the right to accept or refuse medical treatment. And many of these same institutions will not be covered by Medicare unless they offer a person the opportunity to complete an advance directive. So this is a brief little taste about some of the issues that play into the controversy of whether or not people should be given the choice to end their lives.